Have you ever felt that sudden wave of heat, checked your temperature, and seen a high number, but felt completely fine otherwise? No cough, no runny nose, no sore throat. It can be really confusing and a little worrying. You're running a fever, but without the usual cold or flu symptoms. What could it possibly mean? Today, we're going to demystify the lone fever, explore its potential causes, understand when it's a signal to see a doctor, and learn how to manage it. A fever isn't a disease itself, it's your body's natural defense mechanism. It's a sign that your immune system is kicking into gear to fight something off. When your body detects an invader, like a virus or bacteria, it raises its internal thermostat. This higher temperature makes it harder for those germs to survive and multiply, and it also boosts the effectiveness of your own immune cells. So, in a way, a fever is a good thing, but when it shows up alone, it sends us on a detective mission to figure out the underlying cause. So, let's dive into the most common culprits behind a fever without other symptoms. First up are viral infections. Many viruses can cause a fever as the very first symptom, sometimes even the only symptom, before anything else develops. Think about common childhood illnesses like rosella. A child might have a high fever for a few days with no other signs. And then, just as the fever breaks, a telltale rash appears. Some gastrointestinal viruses, often called the stomach flu, can start with just a fever before any stomach upset begins. And in some cases, with a mild viral load, your body might successfully fight off the infection with just a fever, and you never develop any other symptoms at all. Your immune system just did its job that efficiently. Next, let's talk about bacterial infections. These can be a bit more serious and often require medical treatment. A classic example is a urinary tract infection, or UTI. A UTI can cause a fever, body aches, and fatigue, sometimes without the more obvious burning or frequent urination, especially in older adults or very young children. Similarly, hidden bacterial infections like an abscess in a tooth or an infection in an internal organ can present initially with just a fever. Your body is aware of the localized battle happening inside, and it raises your overall temperature to help fight it. This is why a persistent, unexplained fever always warrants a closer look by a healthcare professional, as they can help pinpoint and treat a potential bacterial source with antibiotics. Beyond infections, there are other, less common causes. Inflammatory conditions and autoimmune diseases are a significant category. In these conditions, the immune system mistakenly attacks the body's own healthy tissues, causing inflammation. This chronic inflammation can lead to a low-grade, persistent fever. Conditions like rheumatoid arthritis, lupus, or inflammatory bowel disease can all have fever as a symptom. The fever might come and go, or it might be a constant low-level presence. Another cause can be a reaction to certain medications. This is known as drug fever. Some antibiotics, anticonvulsants, and other drugs can trigger a fever as a side effect. It's an allergic type reaction, and it usually resolves once the medication is stopped. But this should always be done under a doctor's supervision. In very rare cases, an unexplained fever can be a sign of something more serious, like certain types of cancer, which is why persistent fevers should never be ignored. There are also a few other factors to consider. For women, the natural hormonal fluctuations of the menstrual cycle can cause a slight increase in basal body temperature around ovulation. While not typically a high fever, it's a noticeable temperature shift. Dehydration can also cause your body temperature to rise, as can overexertion or heat exhaustion, where your body can't cool itself effectively. Finally, recent vaccinations can cause a temporary, low-grade fever. This is a normal and expected sign that your immune system is learning to recognize and build protection against the disease it was vaccinated for. This type of fever usually resolves on its own within a day or two. So with all these possibilities, how do you know when a lone fever is something you can manage at home versus something that needs a doctor's attention? The key is to look at the big picture, the number on the thermometer, how long it's been going on, and how you feel overall. For adults, a fever under 103 degrees Fahrenheit, or about 39.4 Celsius, that you've had for less than 3 days, and you otherwise feel okay, can usually be managed at home. Focus on getting plenty of rest and staying hydrated with water, broth, or electrolyte drinks. Over-the-counter fever reducers like acetaminophen or ibuprofen can help you feel more comfortable. But remember, they just treat the symptom, not the cause. However, there are definite red flags that mean you should seek medical advice promptly. If your fever is very high, over 103 degrees Fahrenheit, or if it lasts for more than 3 days, it's time to call your doctor. You should also see a doctor if your fever is accompanied by other severe symptoms, like a severe headache, a stiff neck, a rash, confusion, difficulty breathing, or severe abdominal pain. These could be signs of a more serious underlying condition that needs immediate evaluation. For infants and children, the guidelines are stricter. Always contact a pediatrician if an infant under 3 months has any fever. For older babies and children, you should call a doctor for a high fever or a fever that persists, especially if they seem unusually irritable, lethargic, or are refusing to drink fluids. Trust your instincts if you're worried. It's always better to be safe and get a professional opinion. When you do see a doctor for an unexplained fever, they'll act like a detective. They'll ask you a lot of questions about your symptoms, your medical history, any recent travel, and potential exposures. They will perform a physical exam, looking for subtle clues you might have missed. Depending on what they suspect, they might order tests. Blood tests can check for signs of infection or inflammation. A urine sample can check for a UTI, and in some cases, imaging like an X-ray or CT scan might be needed to look for an infection or issue inside your body. The goal is to find the root cause so it can be treated effectively. So, to recap, a fever without cold symptoms is your body's alarm bell. It's often a sign of a mild viral infection that your body is handling on its own. However, it can also point to a hidden bacterial infection, an inflammatory condition, or other issues. The most important things you can do are to monitor your temperature, stay rested and hydrated, and pay close attention to your body. Don't hesitate to reach out to a healthcare professional if the fever is high, persistent, or accompanied by any concerning symptoms. They are your best resource for figuring out what is going on and getting you on the path to recovery. Thank you so much for watching. Please remember, this video is for educational purposes only and is not a substitute for professional medical advice. Always consult with a qualified healthcare provider for any health concerns or before making any decisions related to your health or treatment. We hope this information was helpful and reassuring. If you found value in this video, please give it a thumbs up and consider subscribing for more health and wellness content. Stay safe and stay informed.